coast. Engines roaring, roaring, roaring. The horizon's drawing near. Pedal to the floor, no more feet in the door. Gonna drive right out of this bitter night. I'm a constant seeker in Converse sneakers.
Welcome to Nonprofit Insider. My name is David Unger, and I'm pleased to be hosting a show with the executive directors and key people of local nonprofits. I myself have worked in the nonprofit world for over 30 years. In those years, I've realized that the majority of the community does not know about the organizations that sometimes provide critical services and benefits to our community that we sometimes take for granted. Nonprofit Insider is a chance to hear about the organizations that touch so many in our community. The opinions expressed on Nonprofit Insider are not necessarily those of WMPG, its staff and underwriters, or of USM. So, just an update, Frankie's going to Cape Cod this weekend to participate in a fishing tournament. Good luck, Frankie, and everybody there. Joining us today is Nate Nickerson, Executive Director of Konbit Sante. Did I say that right?
Konbit Sante, great, yeah.
Well,
good.
Why don't we just open up and tell us what it is?
Well, Konbit Sante is a local organization that was founded here in Portland, Maine, got together really in 2000, became a formal organization in 2001, was founded by a local doctor and his wife, Dr. Michael Taylor, and his wife, Wendy. Really was a group of people who got together who had some international experiences, volunteer experiences, that were very much kind of the medical mission type approaches where they would volunteer and go and provide some medical care to some resource poor areas in return. And I think the common denominator among the people who got together was that while that was gratifying, they really felt that there was something missing, that there wasn't a lot left behind when they left. Who was going to take care of the people the next day after they left or the next week? How did it build the capacity of in the area to provide for people long term?
Which area are we talking about?
Well, in this case, people had volunteered all over the place.
Okay.
So this group got together and said, is there a better approach? Is there a way we're interested in being more global citizens and assisting in a way that's more sustainable and more substantial and more impactful than that? And that was the genesis of it.
Okay.
Here.
So what happened after that?
Well, I think immediately after that, there was the idea of looking for a place that would be, I think, interested in a partnership of some kind. And to make a long story short, that ended up being in Haiti and in northern Haiti, and in particular, a particular community. And that's Cap-Haitian Haiti in northern Haiti. And the idea was really to form a deep, rather than sort of a broad impact, but a really kind of a deep relationship with a particular community, really get to understand and know the people there and work with them very closely about helping them strengthen their own health system so that when people aren't there, they continue to grow in their capacity to take care of their own people.
So do you actually provide health services? Do you provide consultation, combination of the two?
Well, we consider what we do... we use the term capacity building, which sounds kind of technical, but we provide support in a lot of different ways to strengthen health systems. So health systems need a whole number of things to work, right? They need people that are trained. They need an adequate number of them. They need the supplies in order to provide care. They need good programs. They need good management. They need finance systems. They need data systems in order to know what's going on. They need to be able to do research so they understand their own situation and can approach it. They need good facilities. They need electricity. They need clean water if you're going to be a health center. So all of those we call the building blocks of a health systems, and we work in all of those areas. And we have both. We support both staff on the ground that work in those areas. All of our staff in Haiti are Haitian. In fact, one of our primary strategies, I would say, is identifying people who really have a lot of capacity to be agents of positive change, but really could use some support in a lot of ways. We use volunteers who are content experts in certain areas, whether that's clinically or engineers or electricians, to work with people there about planning and improving, for instance, infrastructure. We work with some other partners around procuring and getting supplies. including, in fact, we just had a container go out last weekend from Portland with a lot of material that was purchased and donated from facilities like Maine Medical Center that are specific to the needs of our partner institutions there in northern Haiti.
So is it almost a lot of organizations have what they call like sister cities, where there's a match with a specific area or a specific community, and they support and send resources to that community?
Why? We are, in fact, a sister city with Cap Haitian. Portland, Maine
Okay.
is, and Konbit Sante really is the sort of the crux of that relationship. It's a health partnership in that sense. But yes, so even the name Konbit Sante means working. A Konbit is a work group, much like in New England here we think of barn building, where an owner needs a barn built but doesn't have the wherewithal to do it in terms of the workforce or maybe sometimes even the know-how, and the community comes together and builds it together. That group that gets together and works on building something in Haiti is called a Konbit, and Sante is health. So it's really bringing to bear, getting everybody at the table and problem solving, and we do it in a fairly formal, I think, sophisticated way. Identifying what their issues are, what the barriers to care is, and what can be done, what they can do on their own, what they can do with just some technical assistance, what requires resources, and then together we go out and try to find the resources to meet their needs. We don't have deep pockets going into this,
Right.
so sometimes we're applying for other funds to help them meet the objectives that we're working on together.
So when you do an annual appeal or something like that, is it a national or is it within Southern Maine?
I would say that at least half of our supporters are in Southern Maine because this is where it was seeded. But more and more, there's been involvement and support from other areas of the country. So we're definitely Maine-based. Maine, we got Maine DNA, I guess. But even a lot of the active volunteers who are on the ground are from other parts of the country now.
What has been one of the major obstacles that you've had to face? Because not only do you have to raise money and function as a nonprofit in the United States, but you're providing services and support outside of the country.
Yeah, and I think to do work that's really substantial in a partnership like this takes a lot of investment and face time and really understanding and doing a lot of due diligence and paying your dues in terms of putting in the time to understand and develop relationships and know what's going on and be able to sit down and talk very honestly with people. We were in Haiti doing that work for perhaps 10 years when that devastating earthquake struck in 2010. And that probably was a sentinel event, and all of that time invested in really getting to know people and understanding systems put us in a really good position to be helpful and supportive and help them play as big a role as possible responding to that, and then the subsequent color epidemic. And I think that was a real turning point and deepening of that relationship. But it really is I don't really like the term being culturally competent because I don't know that we can ever be that. I much prefer the term approaching people with cultural humility, that we understand what we do, what we know, and what we don't know. And we approach all of our partners with the understanding that they understand their environment a lot better than we ever will. They understand their barriers and challenges much better than we ever will. We can bring some technical expertise to the table and we can negotiate things, and together we can come out with a better solution, which I think is a little counter to how people there often experience people coming in to help who have the answers for everything for them without having necessarily understanding the context in which they're working and the challenges that they have.
Okay. So how do you overcome these type of barriers? Do you have a large staff?
No, we don't, actually. So in our main office here, we have 3.5 full-time employees.
Okay.
Not even that, I guess, 3.2 or something like that. We have a volunteer corps of people that we really value their content expertise. So, and we have a staff in Haiti. So we have an office in Haiti. It's located in in the public government hospital,
Okay.
which is a rare and unusual thing for an NGO to be located
Right.
in a government hospital in Haiti. But they give us that space because they find the relationship helpful. Our staff are there. There are a number of people we support there. But we sit down with people. I guess we're pretty low cost. I mean, we have a small staff. The Minister of Health of Northern Haiti once said to me, he's asking me about how we could help with this thing. I said, Dr. Jasmine, we're really a small organization. He said, well, you're a small organization, but you have a big footprint, which I thought is by really leveraging a lot of different relationships, including the expertise of people who contribute. And
Great. So we're at the point of the show where two things happen. I get to ask you our weekly trivia question.
I've been warned. Yeah.
You've been warned, and the goal really is not to embarrass you, but it has happened on occasion, and then to do our midpoint identifier. So I'll ask you the question, and then I'll go to the midpoint identifier, and then you could give me your response. You ready?
Okay.
What is one of the most popular desserts in Haiti? This is David Unger. I'm the host of Nonprofit Insider on WMPG 90.9 and 104.1 FM community radio of Southern Maine and Eastern New Hampshire. I think he knows the answer.
I know one of them.
Okay. Well, I said one of the most popular, so I could be wrong on this one. Go ahead.
Pampatat.
That's not what I have, but what is pampatat?
It's like a sweet potato pudding kind of. It literally means potato bread, but it's probably the most popular dessert I know.
Okay, well, Wikipedia tells us that Fresco, which can be whipped up quickly. Fresco is similar to Italian ice. However, it contains primarily a fruit syrup. The syrup is moderately thick and very sweet.
I think you better check Wikipedia on that one.
Okay. Well, again, I guess I'm going to be embarrassed this time. So what can I say? It's a two-way street. All right. So we're talking about your organization and the impact that you're making in Haiti. How does a positive impact in Haiti change people here in Southern Maine or wherever your board is located? That's always been fascinating to me. How do you bring what you learn there to improve and grow our community?
Well, I think that there's any number of people who can tell you about what it's meant to them personally to expand their world and their worldview. And I think Portland is a great place to be. It's a little microcosm of a global community here, which I think is a great thing, but also for people to understand better what other of our world neighbors are dealing with, I think is great. We have exchanges as well. I mentioned to you before we got on the air that we have two partners that are here now, our country director and the administrator of the hospital in the big public hospital, spending a week with people with management expertise here, talking about the challenges he's facing administering a 300-bed hospital on a budget of about $50,000 a year, and the kinds of things and what can be done to where he could be more successful at the work that he's doing. I think without exception, people who've just been engaged in a way to meaningfully share their expertise in a way that actually impacts on the lives of others, saves lives, improves lives, is something that has been meaningful. And as a community that's been as fortunate as ours, to be able to share some of those things so that other people can share in some of those things, I think has been really meaningful to people here. I just think a community that's insular and doesn't have arms that reach out and touch and engage in other people in the world is a poor community, and is all the poorer for it.
So you've been involved with the organization for how long?
Since its inception in 2001.
If you had to identify one aha moment that just was an eye-opener for you, that you had no idea was going to happen, what would that be?
Oh, God. Well, Haiti is a wonderful place. It's an extremely complex place. People often underestimate how complex it is. I think every time I go after these years, and I'm there a lot, I get a aha moment that things aren't as I thought. So much is done, often with good intent, based on information that isn't quite how things are. And I'm always just learning something new and fascinating and peeling away another layer of the onion. Most things don't happen as an aha. They're kind of hard-won, long learning processes about, we were really going in the wrong direction there. That wasn't very helpful after all. We really didn't get enough input for people on that. No wonder it's not working, and that kind of thing.
So fundraising obviously is a critical part of what you're
Sure.
trying to do. Did I hear a rumor about something tomorrow?
Yes, well,
We're
tomorrow...
having great weather for it.
Yeah. So our fundraising is a mixture of grants, which tend to be largely sort of project-oriented, building a facility or improving something, that kind of thing. But a lot of our work is supported by both, donors, many of whom are local in the greater Portland area. One of our events that was initiated at the time of the earthquake is this Maine Walks with Haiti, which is a walk around the back cove here. Walk run, 4-mile run, that's a recognized run. That's happening tomorrow morning. People will be gathering at 8 o'clock, and I think the walk and the run will start at 9:30 or so.
Can people still register if they want
Sure.
to?
Register on site. We'd love to have more people. There'll be music and food and other things there.
So it's kind of festive.
It's a festival kind of thing, and it'll happen right across from the Stop and Shop, the parking lot there.
Right, great.
Yeah.
So what are some of the difficulties or challenges you have in fundraising for an organization like this?
Well, I think, being based in Maine, the question you asked about what does this have to do with life in Maine, I think is tough. I think, for instance, corporate sponsorship, people often ask, well, what does it have to do with the community I serve? Because most of the corporations we know and love here locally don't serve the community that we're working in, by and large, and don't necessarily appreciate, and it's difficult to make that connection or connect those dots for people. I think in terms of people understanding, there are many, many projects in Haiti, and trying to differentiate the kind of work that we do from the general way things are done is a difficult narrative to tell. It's not a soundbite. It's a complicated story. I think the kind of news that comes out of Haiti that's focused on tends to be news that focuses on deficits and problems and difficulties and the lack of progress. And so it's a big challenge to cut through that and tell stories that are more hopeful that we experience in terms of going forward.
We're on live radio. Tell us one of these stories.
I mean, one of the things that happened that I feel particularly proud of our partners on, we've been working, again, with we have 4 partners that we work with primarily. 2 of them are public, second biggest public hospital in the country, and a public community health center that serves a slum area. Another private hospital that was actually conceived of and is led by one of our ex-Haitian employees there, a physician, Baptist Convention Hospital, and a health center that's getting off the ground that's all staffed with volunteer Haitian doctors and nurses, which I think runs countercultural, that people are very engaged in that kind of thing. But one of the services that we work with very closely at the big public hospital is pediatrics, and we've been working with them on quality improvement kind of things. How do you improve the outcomes of the patients here? And they really focused on newborn deaths over the past couple of years. And last year, over the past couple of years, they've reduced their newborn mortality, the death rate, by 50% last year over the year before, which is remarkable. Without new resources, without a big influx of money, by taking planful initiatives about how they would do business differently. I think that's amazing. And again, it's really, it's not about money raining from heaven, and they need it. I mean, their resource lacks are staggering, but with committed people making changes in how they do business, it's amazing what can be done.
If a donor would walk in here today and say, I just want to make an anonymous gift of $25,000, what would you do with it?
Well, since our budget this year is about $150,000 deficit, we would probably put it towards that.
No. You're not allowed to use it towards a deficit.
Oh no! You mean what new thing?
Yes.
I probably wouldn't do a new thing, but we're really committed to planning with our partners. And okay, next year, what do you want to achieve? What can we do better? What do you want to do better? What are the outcomes you want? What do you need to do that? What can you do by yourself? What can you do with some technical assistance? And what do you need resources for? And then we come up with a plan, and our budget is based on that plan in terms of those areas where they need resources, some of which we can't find. $25,000, the group that I talked about that is serving a brand new community that's a community health center made up of just really impressive, inspiring people. They've been working really without a salary for 4 years and serving this community that beforehand never had any health services. And they would like to build a community health center there. They're renting a very inadequate space there right now. And I told them if they could acquire some land, we would try to find the financing for that. And they acquired the land. We've had our volunteer architects and engineers come and survey the land and meet with them and do a design. So we have I guess what the Obama administration called shovel-ready program.
Right.
And we would, that's one area we would love to support. We'd love to see that happen for that community and those people because they really deserve a good, decent place to provide the kind of care that they'd like to provide.
How much would you have to raise for that?
About $150,000.
Okay. Which, in the big picture, is not a lot of money.
No, I mean, Haiti, the needs are so great, and it seems like it's bottomless, like millions and millions of dollars. On the other hand, it's amazing what a big impact a little bit of money can have in a community there. It out of proportion to anything it would do here. So that's the flip side of being so resource poor is little things can go really a long way and make a big difference when they're applied thoughtfully. And
so if someone makes a gift or a donation to you, they don't have to worry about the money being squandered or wasted or lost in administrative costs.
I would challenge anybody to be more streamlined than we are. We actually work from a donated space here. We, thanks to Northern Data Systems, gives us an office. We have a donated space there. We have a donated warehouse space here that we use to manage the J.C. Brown gives us for managing the equipment that we bring. I think the overhead I try to reinforce the image of being pretty cheap in Haiti, and I think I'm pretty successful that way. Cheap, not cheap in the sense that we really are very, very careful about where things go.
If someone wanted to start a nonprofit based on your experiences, what advice would you give them?
Well, first I'd ask them why they want to do that. I think I see in Haiti, and actually in Maine, I think the things that we have in common is I think, you may correct me on this, but I think Maine has more nonprofits per capita than any other state in the country.
If not that, real close.
Yeah. And Haiti, I think, has more nonprofits per capita, or what we call NGOs, than any other country in the country, any country in the world, which is a reflection sometimes of poor public infrastructure that's filling in gaps. But one of the things that happens there is they proliferate because people have different ideas about what needs to be done, things that could be incorporated or collaborated or coordinated with existing organizations much more effectively and efficiently, and that doesn't happen. So I think you start one really when there is no other place in which that can sit legitimately. Haiti has the extra level of that the vast majority of organizations that work there are not working legally under the registration and under the authorities of the Haitian government, the vast majority.
One of the things that I always ask a question when someone says they want to start a nonprofit is, whose need are you meeting? Yours to start the nonprofit or the community need? Is there definitely a gap in services?
There's no question. I mean, that is a big issue, and it's something we talk about all the time, is what is the mission about here? Right. Who is this about, and who's the end beneficiary supposed to be about this? Because there are things that would be neat to do and kind of gratifying to do, but they really aren't about the end beneficiary there in terms of...
Do you have any questions for me? I've been asking you all the questions for the last 27 minutes.
I didn't prepare for I think I understand you haven't had a lot of international local groups that.
You're the first. You're the
Great.
first.
What do you think international groups would bring to this community?
I think the way you described it was absolutely what I was hoping for. And the key is I don't see enough of it being told. And when you talk about the story, last week we had 2 other consultants on the show. We talked about telling the story and building the case for support. And fundraising, there are donors out there who could really help out, but they don't know you. And I didn't know you until one of your board members contacted me.
After the earthquake, it was funny. There was a television news spot, and they were outside of our office saying we're going to interview these people from Konbit Sante this evening. Apparently, they've been working in Haiti for 10 years. I've never heard of them. I don't know who.
Right.
So we've been, I think we're a well-kept secret, and we're working on that, and doing public events like the walk.
Hopefully the show helped get the word out a little bit.
Yeah, appreciate being here.
Our pleasure. Well, I think it's time to wrap up. Thank you, Nate, for being on the show, and hopefully we got the message across. Next week, we have Liz Heltzer and David Green from the Holocaust Human Rights Commission joining us. The music appears courtesy of Mike Hubbard. You can find Mike's music on www.michaelhubbardmusic.com. Check out Mike's website to see where he's playing this weekend. Thanks to Deb Danger, NPI's executive engineer. I mean, really, the executive engineer. You can catch Deb on Morning Street, Fridays at 6:30 a.m. If you know of a nonprofit that should be on the show, please email me at nonprofitinsider@davidunger.net. Nonprofit Insider is now on Facebook, and past shows are archived at www.tcmgr.com, NP Insider tab.
Please stay tuned for Zvuki Rusi, music of Mother Russia and neighboring countries at 1:30. See you, David.
Bye.
Bye, Nate.
That will quench my furious appetite. I'm a